We have been here, an anchor in the community since 1903, as consistent as the tide and tuned to the rhythms of our region. We have been here as your neighbor, with a helping hand, growing, welcoming and serving your needs when you need us most. We have been here, the hospital on a hill that now serves as a beacon of excellence when it comes to caring for you and your family. Beth Israel Deaconess Hospital-Plymouth. We are here for you. Since 1903, the former Jordan Hospital, now Beth Israel Deaconess Hospital-Plymouth, is the region's leading healthcare provider, focused on improving the health and well-being of our patients and community. We achieve this every day through excellence, compassion, and attention to the needs of those we serve. From new life to midlife and beyond, Beth Israel Deaconess Hospital-Plymouth provides patients with personalized attention that you expect from a community hospital and the excellence you expect from the nation's most prestigious research hospitals. Don't take our word for it. Achievement across a range of clinical services is consistently recognized by national patient safety and quality organizations. As a member hospital of Beth Israel Deaconess Medical Center, specialists from Boston work alongside our nurses and physicians in Plymouth. If needed, our patients have direct access to our colleagues at BID-MC. We take pride in receiving national and state recognition for our outstanding quality and unique approach to cancer care, the kind of care and support that patients like Daryl Forth count on.
Breast cancer runs in my family. I lost my grandmother to it. I lost my mother to it. It was the diagnosis that frightened me more than any other.
It was the diagnosis that Daryl Forth was given in the summer of 2005.
The technicians and the nurses were wonderful and supported me in a way that I could see a path forward. This was competent, professional support. The oncologist and the nurses were just top-notch. They explained things that I didn't know enough to ask. And when I had follow-up questions, they weren't impatient at all. I always had the sense that there was a team working for me. At the time of diagnosis, I had a full-time job, a busy life, and wonderful as Boston is, I didn't want to be tied to the trip to Boston. It's wonderful to have that all taken care of for you. We're grateful for that.
And she's grateful for the team that continues to work for her today, more than 10 years after her initial diagnosis.
I was diagnosed in July. We had one grandchild born in December, another in March, and twins in May. Now we have 9. The gift to me has been the opportunity to see these grandchildren and watch them grow. So many gifts. So many gifts.
The compassionate care that Daryl received is a hallmark of the hospital, a point of pride for the highly trained nurses and physicians, indeed all of BID-Plymouth's 1,700 employees and volunteers. We are committed to providing the best care possible to our community. Life-saving care in the case of David Liebarger.
February 16th of 2015, I was outside cleaning up the sidewalk a little bit from a snow we'd had the night before. Then I began to feel a little chest pain. So I mentioned it to my wife. I said, I'm beginning to have some chest pain and have had it for a little while this afternoon, and it wasn't getting any better. So I said, all right, let's go to the hospital. We pulled into the emergency room entrance, and I suggested to my wife, Debbie, I said, why don't you park the car and I'll go in and get everything started, because I knew the minute I went into the emergency room and said I was having chest pain, everything was going to start happening.
David didn't know just how right he was. Sitting at the desk was a former neighbor. They didn't have much time for pleasantries.
I said, Beth, I think I'm going to, and that's all I got out. Everything went dark. I guess I went down right in front of the reception desk. I had had a full cardiac arrest, and the whole team came out. They used the defibrillator, put me on a gurney. Next thing I knew, I was in a prep room getting ready to be wheeled into the cath lab for a stint, which was very successful. The ability of the hospital to do what was needed to be done with that stint was everything. It was huge.
What David would come to find out was that after months of preparation, the cath lab had only hours before been certified for just such interventional procedures.
I had no idea I was their first patient in the lab. I would have thought that they'd have been doing it forever. I just can't say enough about them. Well, they saved my life, so I think this is just a terrific resource that we have in the community. And it just appears to be continuing to grow.
Interventional cardiology is just one example of collaboration between Beth Israel Deaconess Hospital-Plymouth and Beth Israel Deaconess Medical Center. Across the board, cancer care, cardiology, critical care, emergency medicine, neonatology, neurosurgery, orthopedics, primary care, and more. We've added top specialists and enhanced existing services with expertise from our colleagues at BID-MC. Of course, not all care in our community takes place in the hospital. In partnership with local school systems and dozens of coalition partners, BID-Plymouth gives back to the community through its Healthy Plymouth program, a community-based proactive approach to enriching the quality of lives through better health in homes, workplaces, and schools. And through the launch of the region's most comprehensive behavioral health and substance abuse collaborative, we are leading the way in the deadly battle against opioid addiction through our award-winning treatment and recovery program that other communities are now adopting across the Commonwealth and the United States. And we're not done yet. As our region's health needs evolve, so do we. That focus on quality improvement, safety, and always placing the needs of our patients first makes us proud to say that we have come a long way, so you don't have to. Beth Israel Deaconess Hospital, Plymouth. Here for you.